Hey there, it's Dr. Brian McKay, Core Health and Darien, and today we're going to talk about knee pain, especially as the weather gets pretty nice out there. We want to get out and start running, cycling, walking, whatever. If you have knee pain, it's going to make it a hell of a lot more difficult. And I want to talk to you specifically about a condition called arthrofibrosis. Now, you would think I make these things up, these names, but I don't. Arthrofibrosis is really kind of a fancy term for a stiff knee syndrome. So a stiff knee is, runs the gamut. Sometimes you have a stiff knee after joint replacement, kind of normal. You can bang your knee and it gets stiff. Um, you can fall down skiing and the knee gets stiff. But so arthrofibrosis is, let's call it stiff knee syndrome. And with stiff knee syndrome, there's many different ways to work it and fix it, basically, because that's probably the most important thing to think about is there are so many muscles involved with the knee. Okay, you have the front of your thigh, the anterior compartment. You have the vastus intermedialis, vastus lateralis, vastus um, rectus femoris. You know, the adductors. So you have so many muscles there. In the back, you got the biceps femoris, which is two heads, semimembranosus, semitendinosus for the hamstrings, um, popliteus behind the knee, pes anserine, which is the gracilis sartorius, and semimembranosus. So you have so many different muscles involved with the knee. And what I suggest people do is a technique called trigenics. Trigenics is a kind of a muscle activation technique. And so what you do is you basically take the muscle, the dysfunctional muscle, you find out if the muscle is weak by doing a muscle test on it. If the muscle fails, then you know which muscles to work, and you basically address only those muscles. But what the idea is you take the muscle through a normal range of motion while compressing on the, call them muscle spindle cells or Golgi tendon organs. Now I know I'm getting a little bit crazy here with the terminology, but muscle spindle cells and Golgi tendon organs are some of the only nerves in the body. These are directly in the muscle, either in the muscle belly for the muscle spindle cells or the Golgi tendon organs or at the very end. What these nerve cells have that's unique is a direct access to the brain. So that the fires directly, the afferent are nerve impulses that go to, afferent are the ones that come back. These are very unique in that they have afferent and efferent capabilities, because typically information is brought into from sensory or proprioception uh, type of input into the brain, and you get a motor response out. So it goes, there's one way in, one way out. The Golgi tendon organs and the muscle spindle cells have two ways, a way in and a way out. So it makes it very unique because the brain needs that information pretty quickly. Uh, so what happens is, they say the muscle's in spasm and it gets deformed. What we do is we take it through a normal range of motion while either contacting, again, if it's the muscle spindle cell or the Golgi tendon organ. And at times it could be a little uncomfortable. It only lasts as long as you make the contact. And that's about 6 to 10 seconds, depending on if you're addressing the muscle spindle cell or the Golgi tendon organ. So by releasing it, you reintegrate the normal motion to the brain, because that's kind of where the problem comes in. The normal motion is not allowed to occur because the brain is not getting the right feedback. So trigenics allows us to do that quite effectively and quite demonstrably, because immediately afterwards you will see the strength return and in many cases see the pain come down. Now, how does that relate to arthrofibrosis? Well, it's a damn good way to not have a stiff knee, okay? But there are other fantastic techniques or tools to use to work, let's call it arthrofibrosis or a stiff knee. And one of them is pulsed radial shockwave therapy. Pulsed radial shockwave therapy is quite a long name, as is arthrofibrosis, but you have a let's backtrack so I can explain it. Everybody probably heard of a kidney stone. Well, if you ever had a kidney stone and you go to the hospital, they break it up laparoscopically. What they do is they put lubricant over the kidney area and they fire away. Well, that same company, using the same technology, has a technique, has a machine for treating adhesions. And adhesions are basically scar tissue. And over time, scar tissue builds up inside the knee, causing the knee to shrink and tighten. And if you can break up that scar tissue, you're going to have more mobility and hopefully a hell of a lot less pain. So the radial pulse shock wave is a fantastic adjunct to soft tissue injury. The speed of healing is greatly enhanced. There is evidence that it helps produce mesenchymal stem cells. Enhances your own body's ability to produce it. It definitely produces angiogenesis, which is increased vascularity and more blood flow. So there's pretty good tools out there. In my estimation, listen, if you're having knee pain a year after knee replacement, you got arthrofibrosis. It does happen. Now, an additional way to be effective with this is to there's a traction unit called the Neon Track. What the Neon Track does, it tractions the knee, and what it does is it kind of milks the joint. It's not a painful treatment in any sense, but it allows the joints to open up. It induces production of synovial fluid. Synovial fluid is some of the most important. It's a lubricant. We don't make as much as we get older, or you're not going to make as much after an injury. So the job here is let's get producing synovial fluid. Now, one of the other benefits of the Neon Track, and it's made by a company out of Conroe, Texas. It's a fantastic treatment for knee pain, especially when you add in radial pulse shock wave and you add in the Trigenics as well. So, but the Neon Track also, one of the big points is it helps stimulate production of chondrocytes. So the chondrocytes are line the bone, and so if you can produce more chondrocytes, it's plasticity. Plasticity is regrowth, so you're gonna have more cells regrow. So, okay, the Trigenics is to enhance the communication between the brain and the damaged muscle. Okay, the Neon Track is to help produce synovial fluid, mesenchymal stem cells, and the radial pulse shock wave is to produce angiogenesis, along with the mesenchymal stem cells. Yeah, that's the radial pulse shock wave. So you have a pretty good arsenal there of things to do for bad knees, especially if you have knee pain after surgery that doesn't go away. People really how many knee replacements can you go for? Well, listen, I hope I haven't bored you. I hope I've informed you. I'm Dr. Brian McKay, Core Health in Darien. I can be reached at 203-656-3636. Oh, and by the way, yes, I'm a chiropractor. A lot of people get edgy with that, but I don't think you care what I do as long as I help you. Hopefully you don't care what I do as long as I get better. All right, listen, you have a great day. Thanks for listening. I hope you're learning a lot. Bye now.